Hello everyone, welcome back to our Fire Nursing tutorial YouTube channel. In this class, we are going to discuss important MCQs. Who all have visited first time on this channel, please do subscribe and watch. We'll see the first question. The primary goal of the primary survey in trauma care is to. Option is B. That is identify and treat immediate life-threatening conditions. Next question. The A in the ABCDE primary survey stands for. Airway with cervical spine protection. Next question. A patient presents with respiratory distress following a stab wound to the right chest. On examination, you note absent breath sounds and hyperresonance to percussion on the right. The most likely diagnosis is tension, pneumothorax. Rex triad, a sign of cardiac tamponade includes hypotension, jugular venous distension, and then muffled heart sounds. Next question. The most appropriate initial fluid for resuscitation in a hypotensive trauma patient is isotonic crystalloid. Next question. In a patient with a severe head injury, the Cushing triad of signs indicating rising intracranial pressure includes hypertension, bradycardia, and irregular respirations. Next question. The Glasgow Coma scale assesses which three components? Eye opening, verbal responses, motor response. Next question. A patient is thrown from a vehicle. On primary survey, they are unresponsive. To open their airway, the manner of choice is jaw thrust. Next question. The golden hour in trauma care refers to right option is B, that is the first hour after injury, during which prompt medical care is crucial for survival. Next question. A patient with a pelvic fracture is at high risk for death primarily due to life-threatening hemorrhage into the retroperitoneal space. Next question. During the primary survey, patient's D is assessed. A Glasgow Coma scale score of 9 would be classified as moderate brain injury. Next question. The recommended sequence for assessing a trauma patient is primary survey, resuscitation, secondary survey, definitive care. Next question. A patient with a flail chest segment will demonstrate paradoxical movement of the chest wall. Next question. In hemorrhagic shock, the body's initial compensatory mechanism is that is tachycardia and peripheral vasoconstriction. Next question. The E in the ABCDE primary survey stands for exposure, environmental control. Next question. A patient with a penetrating eye injury should have a loose shield placed over the affected eye without pressure. Next question. The reliable sign of a fracture is deformity. Next question. In a burn patient, the rule of 9 is used to estimate the total body surface area. Next question. A patient with a suspected spinal cord injury presents with paralysis of the upper and lower extremities and loss of sensation below the neck. This is most consistent with quadriplegia. Next question. The first step in managing a major external hemorrhage is direct pressure at the site of bleeding. Next question. A patient is hypothermic. The most appropriate initial action is to remove wet clothing and cover with warm blankets. Please like, share and subscribe to our YouTube channel for more informative content. Thank you for watching.